The next, let's look at anaphylaxis. Okay, let's look at the next. Let's look at anaphylaxis. We're keeping the same skeleton, which we have learned. So we're fixing everything into the skeleton. Yeah, it's not about the diagnosis management, it's about ABCDE. So A, so anaphylaxis, the patient is not feeling well. Yeah. Hello, Mr. Brown, can you hear me? Doctor, I can't breathe, I can't breathe, I can't breathe. Please help me, I can't breathe. What do we say? Since the patient is talking, the airway is patterned. Then you go to B. Okay, Mr. Brown, let me look at your monitor. Here we looked only at two things. I can see that your oxygen is low and your respiratory rate or your breathing rate is high. That's it. Don't look at anything else. Okay. Now, do you smoke? Have you ever been told you got COPD? No. Give high flow oxygen as usual. Do it for you. The window is open. What's the presenting complaint? Doctor, I can't breathe, I can't breathe. So we're doing the odd para. Then the differential diagnosis, as we discussed. Do you have asthma? Have you ever been diagnosed with asthma? Okay. Pneumonia, any fever, look at the monitor, any cough, yeah, an MI, any heart problems, any high blood pressure, blood sugar, pulmonary embolism, any chest pain. Okay. Are you coughing out in blood? Yeah, any pain in your calf? Anyone in your family has ever developed clots in the legs or the lungs? Okay. Do you take any regular medication? Any allergies? Let me look at your wristband, specific history. Now, what you see that the patient is receiving blood transfusion. So I can see that you are receiving a blood transfusion. You are not feeling well. Let me stop the blood transfusion. So you're going to have to clamp it down, stop the flow. This can be done at very early. The moment you see the patient is unwell, and you see is receiving blood transfusion, you need to stop it. Anybody who is unwell, whether with chest pain, whether with fever, shortness of breath, if they are receiving blood transfusion and they start becoming unwell, the blood transfusion need to be stopped. Okay, so we're going to stop that and then ask the rest of the history. Okay, so what do we find? Okay, why is the patient taking blood transfusion? So you had an operation. What operation did you have? Was there any complication during an operation? Okay. Then we're going to mention, we need to check the post-operative notes. This patient is post-operatively, so we're going to check the notes after the operation, okay? Just to see what was done and if there was any complications. I also need to have a look at your drug chart, where what you may find when you check for allergies, patient is allergic to penicillin. Yeah, patient is allergic to penicillin, so you have to check that on the drug chart, he has not been given anything he's allergic to. You also have to check the general notes of the patient. Yeah, we check the general notes of the patient just to see for background information. Okay, good. So that is looking around. I need to examine you. We do a respiratory examination. What do you find on the respiratory examination? Okay, what you find, there is a wheeze. There is a wheeze. There is a wheeze. So what you're going to do? Again, same. Nebulizer salbutamol, 5 milligrams, driven via oxygen. Do it for you as usual. What else we need? ABG, a chest X-ray. We come to circulation. The blood is anaphylaxis. Blood pressure is low. Heart rate is high. Okay, and then monitor. Yeah, shows sinus tachycardia because it's anaphylaxis. Yeah, is in shock. Good. Skin color. You need to check the capillary refill. Skin color, skin temperature. Auscultate the heart. There is a wheeze, so only on one position. We need a full ED ECG. Because the patient is postoperatively, we're going to assess the abdomen and external genitalia as part of what? Circulation. Yeah, as part of our circulation. Okay, so what we're going to do in there, I need to have a look at your tummy. What you're going to find, the patient is after the operation, there will be a wound dressing. Okay, I'll be pressing gently, he will be in pain, just light touch. Okay, I need to have a look in your private area as well. Is only post-op. So what can you find? There is a catheter. Is it draining? Is it draining clear urine? So urine output is good. Okay, good. So now we're going to manage. Now the first thing going to manage in here is IM adrenaline. Okay, now you get questions. Do I give IM adrenaline before assessing these things? No, you need to do assess and then manage. Okay, then you're going to get IM adrenaline 1 in 1,000, 0.5 ml. Now, you need to pick up the correct. There are different types of IM adrenaline, 1 in 100, 1 in 1,000, 1 in 10,000. You need to be careful in picking up. Pick up the right adrenaline. Yeah, adrenaline IM 0.5 ml 1000. Okay, then get an IV line. So that's the first thing we do. This is the first thing we do, and then you get an IV line. Yeah, wide bore cannula, the biggest gauge you have in place. Send a routine blood test. Yeah, including a group and save again, because there's a reaction. Then get IV fluids. How much and how quick? This is a fluid start. 1 liter normal saline, 0.9, okay, in both arms, as fast as possible. It's an anaphylactic shock. Okay, good. Now, in here, we know IV medication. We don't give the hydrocortisone or chlorpheniramine at this stage. We would probably give this medication at F, after stabilization, not during acute assessment. Yeah, we're not going to be giving them at this stage. Then D, disability. Yeah, patient is talking to you on AVPU system. My patient is alert. PP's glucose normal. Review the treatment. What have we done so far? We have given oxygen. We have given nebulizer. We have given IV fluids. Okay, so we review. How are you feeling, Mr. Brown? And what's the blood pressure? The blood pressure is low. So then what can you do? You repeat adrenaline. If your blood pressure is not adequate, you repeat adrenaline. If it has improved, it is okay. Okay, good. Now, E, I need to examine you. Now on the E, we have done the abdominal and the private area already. So what you're going to do, we look at the legs. Okay, what you may find, there may be rashes. Yeah, rashes may be in the groin, in the legs. Okay, good. So we finish E. Is the patient stabilized? Then further management. We explain to the patient, okay, Mr. Brown, I have assessed you now. You had a shortness of breath. On examination, your oxygen was low. You had the wheeze. You had the rashes, maybe rashes on the chest, rashes in the groin, rashes in the legs. Okay, I feel what you have is a severe blood transfusion reaction, okay, or anaphylactic reaction. Yeah. Now, why you had this reaction to your blood transfusion is not clear. We have to investigate, get to the bottom of the problems. Okay, we're gonna take this blood, send it to the lab again for further investigations to find out why you had this reaction. There are several reasons why people may react to a blood transfusion. Sometimes they could be given a different type of blood group, but usually we check, but we need to double check what exactly happened. Sometimes your body can just react to a blood transfusion. Okay, we have to investigate, get to the bottom. In the meantime, we're going to continue monitoring you. Okay, continue the current treatment. We've requested for some investigations, which we're going to chase up. And as well as I'll talk to my seniors. If they suggest anything different, I would let you know. Okay, so that's easy anaphylaxis.